Hello, my name is Joey Callahan, a BSN student at Florida Southern College.
And my name is Amy Willaba. I'm also a BSN student at Florida Southern College. And our global health analysis research is centered around the COVID-19 pandemic and its impact on education in South Africa.
So as we are all aware, COVID-19 has had such a significant impact on our education systems worldwide. Since the first reported case in 2020, we have personally experienced COVID's impact in the classroom. And fortunately, we had the resources available for us for online learning and then the PPE available to continue in-person classes safely. However, the COVID-19 pandemic globally impacted about 1.6 billion students through the closure of schools.
Not all students across the globe had the same resources that we were fortunate enough to have. The pandemic brought about an educational crisis, significantly affecting those in low-income countries. One of these countries is South Africa. And in March of 2020, the South African president declared a national state of disaster due to the pandemic. This led to the immediate closure of all schools. The impact of learning was determined by many factors, including access to resources. According to Dr. Lagrange at Stellenbosch University in South Africa, students of higher class were able to easily migrate to online learning. However, this was not the case for students of a lower socioeconomic status, and it was published that only 22% of households in South Africa have access to a computer, and only 10% have internet connection. So a large portion of South Africa was without any form of education for an extended period of time.
Additionally, factors prior to the pandemic did not allow for proper education in the first place. Unhygienic schools lacked resources such as running water and supportive infrastructure to support their students. In relation to the pandemic, we can imagine that the school systems were not prepared for interventions to prevent COVID, such as the space for social distancing.
If you look at the photo in the middle of our poster, you'll see children in Durban, South Africa that are in school. I actually personally took this picture when I traveled to South Africa. My aunt is a former school teacher in a very low income area. And as you can see, the children are all close together, and I was able to witness their interaction and how being with each other promoted their learning. Taking this away from them not only had negative impacts on their learning, but their lack of education will have long-term impacts that we have yet to see.
And so some of the strongest impacts on the education, on the education system included not only learning loss due to lack of school attendance, but it also led to an increase in mental distress, exposure to violence and abuse in the household, the loss of social development, and the lack of nutritional meals that many students needed to meet their caloric intake. It was also mentioned that students were behind nearly 75% to 1 year in the education they received. And this may be in part to a lack of teachers available within the country. As discussed in Shanila Mohammed's article published in 2021 through the Amnesty International, they mentioned that roughly 1,700 teaching staff had actually passed away due to COVID-19 by the beginning of 2021. This is a significant loss to the education system and was an unforeseen problem that severely impacted the students in South Africa.
I also thought it would be important to discuss different demographic groups and how they were disproportionately impacted by the pandemic. Gender played a large factor in this, and sources found that in South Africa, learning losses for girls were 20% higher in home language and 27% higher in English reading compared to boys. So those are significant losses that affected girls more than boys. And then also in grade 4, girls lost an average of 9 words per minute in reading speed, whereas this was only 6 words per minute for boys. And this is important to recognize when implementing interventions so that there can be more of a focus on girls and other identified demographic groups that may be struggling more when it comes to education.
So what can we implement to help this population? We identified primary, secondary, and tertiary prevention plans to help the education system crisis. So primary, the first strategy or intervention we identified was promoting vaccinations and education surrounding COVID-19 vaccines. In South Africa, we found that there were 3 primary vaccines being used within the country, and these included Johnson & Johnson, COVAX, and Pfizer. Disparities within the lower socioeconomic areas in South Africa are very present, and with significant lack of medical infrastructure, lack of strong communication with rural communities, and overall doubts in the efficacy of these vaccines, it is increasingly challenging to promote the use of modern medicine, such as the aforementioned vaccines. Moving forward, it might be in great interest for South Africa to promote COVID vaccinations in school populations, and it is essential to provide resources and educational information to increase vaccination rates among this population. As mentioned before, nearly 1,700 teachers had passed away before the year 2021 due to COVID-19. And with this lack of educators, it becomes increasingly difficult to open back up schools in South Africa and engage rural communities in returning back to school. To prevent future loss of educational staff, it is important for them to understand the importance of these vaccines to protect not only themselves, but also their students and their families.
So on to secondary prevention. When we were researching how we can support the education of children in South Africa, we came across something called the PAL Network. The PAL Network is a partnership of organizations working across the globe to promote education. And so this network is already represented in countries bordering South Africa and all around the world. And something important that is offered by this initiative is the promotion of oral assessments, such as ICANN. And so ICANN stands for the International Common Assessment of Numeracy. We pulled the green graphic that you see below from an educational material from the PAL network, and it explains the steps of ICANN. So basically, there is a random oral assessment of children between the ages of 5 and 16, and they are assessed 1-to-1 without the assumption that they can read or write. So it takes the pressure off of that. And demographic information is also collected about the children, and the results are used to determine learning issues for different populations. So using this as a screening tool could be really beneficial, and it would show the needs of demographic groups that may be struggling more. And then moving on to tertiary prevention, the results of this ICANN screening can then be used to determine critical areas that need to be a focus of future education. And implementing this will aid in restoring some of the missed education of students who faced education barriers in the pandemic.
And so the second tertiary intervention included in this presentation is supporting parents or caregivers who are at home caring for their children who are no longer in school. As mentioned before, students have relied on the school system for food and caloric intake, and it would be more challenging for parents and caregivers to provide nutritional meals for their children throughout the day. For those individuals who are caring for their no longer active students, it is important to spread awareness about mental health in order to reduce burnout or caregiver role stress. And additionally, parents or caregivers that would be able to provide schooling or teaching to their children if additional school resources were to be given to them.
So as we have discussed, education as a whole has been greatly affected by the COVID-19 pandemic. It is crucial that we intervene in order to rebuild the education system in South Africa. Many children are in desperate need of support.
And there are current initiatives in place coordinated by organizations such as the PAL Network across the world. With COVID-19 headed in a positive direction, in a more positive direction, we can look forward to what steps and interventions we will take in order to restore normalcy. We want to thank you so much for listening to our presentation and for allowing us to share our findings with you.
Thank you.